Hi, welcome to class 1, Yoga and Stretches for Dental Professionals. We're going to start by talking about the head and neck. I described this a little bit before, but you can either watch the video this video that I'm creating, or you can scroll through the PowerPoint on your own. There is going to be a little bit more detail in this video, a little bit more explaining of what's going on, but you're welcome to choose either one, whatever works best for you, however you learn best. But let's start class 1, yoga and stretches for dental professionals with the head and neck. Oddly, the neck is the most common place that people experience pain, that dental professionals experience pain, which is why I wanted to start there. I wanted to first talk about how we obtain musculoskeletal disorders or cumulative trauma disorders. Now, musculoskeletal disorders, or MSDs, are accumulated over a period of time. It's not common that these are just gained right away, especially in our profession. Usually what happens is we have some kind of a risk factor to begin with. In this slide, the risk factor is prolonged static posture. Prolonged static posture is where you sit really still in one position for a long period of time. But there are other risk factors like improper ergonomics, like holding your head like this and getting in your patient's mouth like this, just really awkward positions that's going to hurt you in the long run. Another risk factor is improper lighting. If you don't have a good headlight, if you don't have a good overhead light, you usually crane your neck a little bit more to see. Sometimes we don't have the best instruments. Our instruments are dull or not sharp, or they're not up to date with what we need right now. So there's a lot of reasons why you could start to experience muscle fatigue and muscle imbalance, which is the next step. Once you are experiencing this fatigue and imbalance, you usually stop using certain muscles. So you'll have a muscle, say, in your hand that you're using. Eventually you start to experience pain, and you actually use some kind of muscle substitution in another area. And this muscle, which is still in that static posture, gains ischemia and necrosis. And ischemia is a loss of blood flow, and necrosis is tissue death. So these two things right here are found in the majority of musculoskeletal disorder development. And these lead you to have pain. And as you have pain, you again have other muscles contract and try to help things out. And then eventually you get joint hypomobility and nerve compression, which is, you see nerve compression in carpal tunnel. It's compression of that median nerve, or spinal disc degeneration. There's a lot of that for dental professionals in the neck and in the back. And that's when your trauma disorders or your musculoskeletal disorders develop. There is a lot of risk factors, and sometimes we can control them and sometimes we can't. Sometimes we are able to get sharper instruments and better instruments, and sometimes our office can't afford it. Sometimes our light goes out on our little loops that we usually wear, or sometimes you have a patient who's elderly and they can't, they have to sit up or be in a position where you are not using proper ergonomics. You have to crane your head and your neck to get the view that you want. So I've decided that with this course, in order to address cumulative trauma disorders and musculoskeletal disorders, we're going to attack it right where that yellow arrow is, at the muscle ischemia and necrosis. I figured that by stretching the muscles through yoga and through stretches, we are going to be oxygenating them by increasing the blood flow. And this should create more balance and decrease the likelihood of obtaining these disorders. So moving on to the next slide, This is proper ergonomics for your head and neck. And like I said, ergonomics is the position you should be in to reduce the amount of trauma that you're going to receive during work. So your head and your neck should only be tilted forward about 20 degrees. Your neck should not be bent from one side to the other. And you also shouldn't really have to turn it too much during treatment. You should be able to just kind of move your chair over if you need to get something, or move your chair over again. But for sure, your head and your neck shouldn't be bent. And this does also include your upper torso. You may need to bend your upper torso forward, but you should never go beyond 20 degrees. I did want to note, though, that when we're talking about not moving your head, we're not talking about this in general. This is just while we're working. Movement is good because, like we talked about just barely, it increases blood flow and oxygen to muscles. However, prolonged static postures are bad. So if you're in this place and you're experiencing pain and you're doing all you can, you're at the 0 to 20 degrees, your neck isn't bent anywhere, maybe it's time to stand up and stretch a little bit or take a little break. Because what leads to trauma is working through pain. So there's 3 neck stretches that I wanted to address in this class. And neck stretches, these neck stretches are not yoga poses. And there's a few things you need to make sure you do while doing them. One is your shoulders need to be relaxed. The other is your hands need to be down on your lap with your arms by your sides or behind your back. I have seen a few instructional things that say you can also sit on your hands to keep it down. But all of these neck stretches should be controlled. We're not flopping our head side to side, rolling it around. Everything is controlled. So if you feel anything abnormal, like shooting pain, numbness, severe tingling, or anything else that's abnormal, your medical professional should be consulted. But starting with the upper trapezius stretch, with this stretch, we bring our ear to our armpit. So you're going to bring your ear listening to your armpit, and if you need to, you can use your hand to deepen the stretch. Again, making sure that your shoulders are relaxed and your arm is down. And that's going to stretch, as you can see, this upper trapezius area. The next stretch is the levator scapula stretch, and this is where we smell our armpit. So you're going to bring your nose to your armpit, and again, use your hand to deepen the stretch if you need to. And that's going to target that levator scapula right along the back of your neck. The last stretch that's going to be on the test, so these 3 stretches will be on the test, is the scaling stretch. And in the scaling stretch, you're going to tilt your ear toward your shoulder and use your hand to increase the stretch if you need to. And that's just going to stretch your scaling muscles. So this stretch, this last one, I wanted to address it. It's also a stretch for the neck, but this one is not going to be on the post-test just because it's a little bit more difficult. With the sternocleidomastoid stretch, you start kind of in that scaling position where you're bringing your ear to your shoulder, but then you're going to tilt your head up towards the sky and pull with your opposite hand, and it should be stretching your sternocleidomastoid muscle, which goes from your clavicle all the way up behind your ear. But yeah, that's it for the neck stretches. And thank you so much for participating in Class 1's instruction.